Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 5 of My Aunty is in intensive care on Ecmo for ARDS. We're very worried she may die. Help. Part 5. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is part 6 of My Aunty is in intensive care on Ecmo for ARDS. We're very worried she may die. Help. Part 6. Lee from the UK writes, Hi Patrick, we've been back to hospital today and my auntie was quite bad overnight with gases in her blood. Today, however, they have managed to remove all gases and it's at 100% normal levels, and they're draining 150 mils of fluid per hour off her by dialysis to help drain the fluids. She isn't passing any urine herself, but I think that's because of oxygen requirement levels. Her ventilation support was as low as 30% oxygen today, but was back to 50% by the time we had left. We were told this was normal after physiotherapy and will probably be reduced later. My auntie's lungs are still wet and they said they will keep draining her by dialysis in the hope that the drier she gets, the less support she will need, and that will allow her lungs to expand more and hopefully repair itself. They think there is an underlying problem from her original diagnosis, pneumonia, but normally patients would have been off Ecmo and got rid of the pneumonia by now, and they can't understand why this is. They also said that they will keep drying her out until they can identify the cause, and if they can treat it, they will, if it's treatable. We also spoke with the Ecmo team today, and she hasn't got any chance to go on Ecmo back at all, because she wouldn't last on that, and also because she has been asleep for such a long time and on the ventilator for so long, and that they apparently know that through past experiences. They also said you can't go on Ecmo after you've been off it for so long. Today we spoke to her consultant, who was very keen with questions about my auntie's mental health, and has she ever had quite a long period without her tablets. Although she's been diagnosed with schizophrenia and she's on medication for this. Quite a few of her support workers over the years, and also my mum, questions whether she actually is schizophrenic, as she only ever has thoughts now and then and not actually verbally hears or sees people. Also, during support groups she attends, she doesn't display the same behavior as them, or has the same mannerisms, or just doesn't seem the same at all, just like she suffers from a bit of depression here and there and enjoys the company of the support groups. She's currently on sodium valproate, diazepam and a few other tablets when required. Would that give her a low cell count and a low immune system? Is it relevant in any way? Would stopping one or more of these medications make any difference? She has an infection as well, but we're not sure what infection, and infection markers are coming down slowly. They also asked if they can't find a solution what we think about a lung transplant. They also said that it's a long process and there is a very long waiting list, but that's not to say they wouldn't even accept her onto the lung transplant waiting list. What do you think, Lee? Hi Lee, thanks for the update. The most important thing that stands out to me in your email is that the Ecmo team says that your auntie can't go back on Ecmo. That is complete and utter BS. I have seen many patients who have gone back on Ecmo after they have been on it before. I believe the intensive care team and the Ecmo team are trying to plant a seed there for you and for your family that she can't have it back for whatever reason. There is absolutely no reason why your aunt or sister can't go back on the Ecmo. The only reason why she couldn't go back on it would be the low platelets or any other issues with her blood being too thin, and that could cause severe bleeding on Ecmo. That would be the only risk that would make it almost impossible for your auntie to go back on Ecmo. unless there are other reasons that you haven't mentioned that would stand in the way of going back on Ecmo. Also, it's complete and utter nonsense to say that your aunt can't go back on Ecmo because she has been asleep for so long and on the ventilator for a long time, and through past experience they said also that you can't go back on Ecmo after you've been off it for so long. Again, this is BS, and I have seen patients being on Ecmo for up to 3 weeks, and that time period would have included patients coming on and off Ecmo within those 3 weeks. Again, check out this article, How Long Can a Critically Ill Patient Stay on Ecmo? It's certainly a relatively high risk to go back on Ecmo if needed, and one has to certainly weigh up the pros and cons before making such a decision, but the reasons they are giving you are nonsense. Ask them about their past experiences, let them give you the facts. There is absolutely no reason why you can't go back on Ecmo even after your auntie has been off it for so long. Also, the mental illness of your auntie shouldn't be a point of discussion on what type of treatment she gets while she's in intensive care. I wouldn't even go there if I was you, unless you feel that it's relevant. If the intensive care team thinks that the mental illness of your aunt is relevant for what type of treatment she's getting or not getting whilst being critically ill in intensive care, you need to ask a few simple and very effective questions in order to determine your next courses of action. For example, has your aunt or anybody in your family ever mentioned that she doesn't want to live? Or has your aunt documented an advanced care plan? For example, does she want to have certain things done or not done in case such a crisis like this, like she's in now, emerges? The answers to these questions should be determining in how you position your aunt and how you advocate for her. Don't worry in how the intensive care team or the Ecmo team positions your aunt's prognosis and diagnosis, because it sounds to me like they're looking at her mental illness as well as her ICU stay to be the determining factors in what they offer or don't offer in your aunt's current condition. I would almost argue that by only having your aunt on Ecmo for 6 days initially wasn't enough in order to let her lungs heal and rest after the ARDS. Most patients that I've seen and looked after on Ecmo for ARDS had been on it for at least 1 week or more in order to give enough time for the lungs to heal. It gives, in essence, the lungs more time to heal and rest. Also, they can't tell you that Ecmo might be unavailable. Whenever there is a crisis, especially in peak winter times with flu, pneumonia, etc., where Ecmo could be a lifesaver, usually Ecmo machines can be made available from the manufacturers themselves in order to facilitate demand. Going back to what happened yesterday, overall it doesn't sound like you need to panic though. Oxygen demands can go up and down, and if her oxygen requirements stay between 30 to 50%, that's actually not too bad. And on those oxygen levels there's no need for Ecmo anyway. Again, given that your aunt's lungs are still wet, it's also a sign that ARDS is persistent. If you have read through our section about ARDS, you can see why the lungs would still be wet. It's good that they keep using the dialysis machine and drain fluids. Also, as far as the lung transplant goes, lung transplants are a last resort after Ecmo has failed. But you need to be prepared, and you need to be able to argue your aunt's case in case things don't go well. Again, things happen slowly in ICU. It sounds like your aunt isn't going backwards though. 30 to 50% oxygen requirements isn't too bad and keeps her away from Ecmo for now. Be patient. Again, read through Ellie's questions. It could well be that you are just at the beginning of a journey. As far as the medications for your aunt's mental illness go, I couldn't tell you how they affect her current situation. However, it's unlikely that those medications interfere with what's currently happening clinically. Again, as I mentioned before, your aunt's mental illness should be out of the equation for now, as she's battling much bigger issues. Keep this in mind as long as she's fighting for her life. Her mental health issues should not be becoming an issue as long as she's critically ill. We are talking about death or life here, and not about a mental illness. If you and your family think that she wouldn't want to live because of her mental illness, then you might have to rethink your strategies And as long as that's not the case, you need to reframe and re-emphasize your positioning to the intensive care team and ask for nothing but the best. Also, I link to a few articles here about induced coma and how long critically ill patients can stay in an induced coma, so that you are well informed. So check out those articles on our page on our website intensivecarehotline.com below the video. And another article that I'll link to is how to play a high stakes game that only the intensive care team knows how to win. You should check out this article, as a matter of fact, to give you more strategies in how you can manage the intensive care team effectively. So stay strong, always keep making up your own mind, and never give up. Thank you. So, how can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind the scenes insights so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Also check out our product section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype or over the phone. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.